Welcome to the module Respiratory Syncytial Virus, RSV, in Older Adults Prevention, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of individuals. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a critical role in providing care to individuals in many settings of care. Because direct caregivers spend a great deal of time with those they care for, they are better able to recognize and understand the needs of these individuals. They are also more skilled in identifying when someone is experiencing a change physically or cognitively. The purpose of this course is to further your learning and build on your current knowledge about preventing respiratory syncytial virus (RSV). What you know and how you use that information improves the quality and safety of the people you care for. This learning module, Respiratory Syncytial Virus (RSV) Prevention, is part of a series of two modules exploring RSV in older adults that are helpful to assist direct care workers identify and assist in preventing the transmission of RSV. You are viewing the second module of the series, which provides additional information about preventing RSV in older adults. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any module at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. After reviewing this module, learners should be able to describe several key strategies to prevent the spread of RSV and understand when to notify licensed nursing staff about a changing condition. RSV is transmitted when an infected person coughs or sneezes. The virus droplets from the cough or sneeze enter another individual's eyes, nose, or mouth. Therefore, it is important that you cover your nose and mouth when coughing and sneezing and keep your hands away from your face. It is also important to stay home when you are feeling sick and to avoid close contact with potentially infected individuals. You must also be sure to clean your hands with an alcohol-based hand sanitizer or soap and water. We will talk more about hand hygiene on the next slide. Hand hygiene plays a critical role in the prevention of RSV transmission. Either alcohol-based hand sanitizers or soap and water can be used to clean your hands. Hand hygiene should be completed before and after touching your eyes, nose, or mouth, and before and after changing wounds, dressings, or bandages. It should also be completed after blowing your nose, coughing, or sneezing, as well as after touching surfaces such as bed rails, bedside tables, doorknobs, remote controls, or phones. Hand hygiene must be completed every time you go into a person's room and when putting on or removing personal protective equipment, gloves, gowns, masks, eyewear, etc. Always use personal protective equipment, PPE, when transmission is likely to prevent the spread of further infection. To reduce the chances of spreading RSV, it is important to clean and disinfect surfaces that are frequently touched. Some examples include bed rails, bed frames, tray tables, bedside tables, handles and doorknobs, IV poles, and other medical equipment such as blood pressure cuffs, thermometers, etc. Be certain you're using the correct cleaning and disinfecting products. To reduce the possibility of transmitting RSV, both contact and droplet precautions should be followed. Contact precautions include performing hand hygiene before entering and after leaving a room, putting on gowns and gloves before entering a room, discarding your gloves and gown after leaving a room, and using dedicated or disposable patient equipment. Since RSV is transmitted by an infected person coughing or sneezing, droplet precautions should also be followed. Droplet precautions would include having the resident in a single room if possible and wearing a mask when in close contact with the patient. It is acceptable to share a room if precautions are taken, such as maintaining 3 feet of distance between patients, as well as keeping the curtain closed between them. In May 2023, the U.S. Food and Drug Administration, FDA, approved the first two vaccines, which will be helpful in reducing the risk of more severe RSV symptoms and the need for hospitalizations in adults 60 years and older. The vaccine should be available to patients in the fall of 2023. To prevent the spread of RSV and to reduce the complications of RSV, it is important for direct caregivers who spend the most time with patients to notify licensed nursing staff as soon as possible if any of the following symptoms are noted. These include a runny nose, coughing, sore throat, headache, fatigue, and/or fever. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Respiratory Syncytial Virus, RSV, and Older Adults Prevention quiz on the Frontline Forces webpage or in the YouTube description below. This material was prepared by the Superior Health Quality Alliance under contract with the Centers for Medicare and Medicaid Services, CMS, an agency of the U.S. Department of Health and Human Services.